I think it's important for folks to know that really, although most of the largest problems are in the long term, as we look forward with our aging society and our demographic shift in this country, it's hard to wrap your arms around $18.1 trillion in debt. But it really does affect all of us. When you start to break that down into how much each household might owe, or if you break it down further, like you said, into a family's household budget, how much money are we bringing in with the jobs that we have, or the jobs, and how much do we want to spend? How much are we spending? How much is required to spend to get ahead, and try to negotiate that. You want to have some savings, you want to have some outlook for the future for retirement, but you also have things that you need to do here and now, whether it's healthcare. Do we have healthcare coverage? Do we have to buy it on the free market? Are we lucky enough to have our employer sponsor it? All those sorts of questions. Education's really important. If you have a family and you have children, you care greatly about their ability to get ahead, which weighs a lot not only on their health, but also their education and your engagement with them. So we try to break down something that is really, really challenging to talk about, a humongous amount of national debt, into practical terms. But also, all of the states are dealing with their own state budgets right now. There's lots of talk about whether or not we should have Medicaid expansion, whether we should not have Medicaid expansion. What are we doing for the infrastructure in our states, as well as paying for K through 12 and higher education? So it's very, very similar conversations going on in state houses, in the local newspaper, as it is at the federal level.